Now, functional medicine. Now, what is that? A lot of times people don't understand what that is.
People don't. And so, and really, I spent the first many years trying to explain to people what it is. And I think it's going to catch on a little bit more now. Uh, we'll see what there's some big things happening coming out in the future about functional medicine. So people need to just hang tight. But at the same time, we're going to explain to what it is getting to the root cause instead of that pill for an ill approach. Like a patient says, I'm having an issue. In fact, I just finished doing a meet and greet with the patient because that's what I do. I'll meet with them, answer their questions, get to know them even before they become a patient in the practice to make sure that we're both a good fit. And
Hmm.
so she's like, I don't want to just go to another doctor and get antibiotics. I mean, she was on some antibiotics and they're just tearing her up. And so we were sitting there talking about, she goes, the reason why I'm here is I don't want another antibiotic. I want a doctor who's going to sit and listen to me and get to the root cause. So what functional medicine is getting to the root cause of why people have their issue, not just giving that pill for an ill. And it's also having the patient come in and let me get to know everything that's going on around you because I can get at a wider and a deeper, get to a root cause issue instead of sending them to every specialist that come, it's not, they don't have to go to specialists all the time because I will sit there and address a lot of what's going on with them
Right.
if they have autoimmune or if they're having gut issues or if they're having those hormone problems or if they're like, I don't really know, I'm going to all these specialists and they can't find out what's wrong with me. I'm going to say, well, let's look and see what the root cause could be. Maybe you're exposed to some toxins.
Hmm. Right. Right. Yeah. No, well said. I mean, I just think that um, we need to get to the root cause and be more root cause focused to help people instead of just treating the day to day issue or the issue of the moment. Getting to the root cause, that should always be the goal of every patient journey. And I just think in conventional medicine, you know, I've been there too. I've been in conventional medicine, just like you have. Uh, that just doesn't happen. There's too many patients, not enough time. I call it conveyor belt medicine. Um, where a person's seeing, like you said, like 30 patients a day, a patient every 15 minutes, a new patient every 30 minutes, while they're doing like 10 callbacks, looking at 17 x-rays and writing 11 prescriptions throughout the day. There's just no time to actually spend with the patient. You only have 15 minutes to spend with that patient and to figure everything out. And that sliver of time, can't do it.
No.
Um, I
But yeah,
mean,
that's when patients come to me, instead of them being on a whole laundry list of medications, I'll sit down and, we'll go through. And my objective is to get them off of medications, but not
mhm,
only keep them out of the hospital. I can't even remember the last time one of my patients has been in the hospital. It's crazy. They're healthier. They are on less medications.
yeah,
They're not going to as many, most of the time, they're not going to as many specialists. And and they all just say, I love the reason why my practice, the patients love it on top of that is like, they're like, well, I go to the GI doctor, I'm going to the pulmonary doctor, I'm going to the allergist, I'm going to all these different specialists, but no one's talking to each other. And they're having, I call it the silos of different specialties.
yeah.
And so saying, well, let me take all of this and I'm going to be like your quarterback.
I love it.
I'm going to this together and I'm going to help. Let's make a plan and I can have that continuity of care that you need. And they want it, but they need it. And we're going to say, do you really, we want to make sure everything's talking to each other. Like, they're like, well, do I need to be on this medication? Because I think this medication is causing another side effect. And is this, and they just don't understand and they're confused.
Yeah.
And they don't always need to be on, and maybe a lot of their problems why they're feeling bad is because they're on a medication that doesn't agree with them or it could be interacting with something else that they're on.
Yeah, well, yeah, exactly. Well said. I mean, taking the time to figure that out, tweet that out, is everything to having a smooth journey, with our patients. Now I want to get into the book here. I want to talk about hormones and who needs them, why do we need them, when do we need them, how do we need them, what forms do we need them, what should we know about hormones, and when should we ask about hormone supplementation?
Well, I'm going to say, as we age, we start losing a lot of the things that keep us young and healthy and such. And one of those is hormones. And as especially, and it's not just women, I'm talking about for men as well. And I talk about this, but women start going through perimenopause, which means your hormones start changing and you'll start getting the waves up and down of the estrogen and the progesterone and the testosterone changes. And the hormones really control so much in our life, like our mood, our brain, our heart, really everything. And they're all tied together. So hormones are anything from estrogen, testosterone, progesterone, DHEA, but it also entails thyroid and your stress hormone, which is cortisol.
Mm-hmm.
So as we start aging, we start losing these things. That's what causes our chronic diseases to really increase in our body.
Mm-hmm.
And we know now with all the research, now I'm going to go back to 25 years ago when the WHI study came out that women were taking off their hormones, and everybody got scared. They go, you can't be on hormones. It's causing cancer. Breast cancer is causing stroke, blood clots, all these things. But those hormones back then were the synthetic hormones. Now, synthetic hormones are the ones that are not identical to what our body produces.
Right.
And our body, back then, yes, the synthetic hormones like the estrogen,
right,
made from horse urine.
Yeah, yeah.
And then the progesterone was not even a natural. It was called a progestin, which was very inflammatory to the body.
Right.
So all that Prempro, Premarin, all that's been pulled off. And people shouldn't be on that medication even today. But since that time, there's always a silver lining. All the research is coming out, and now we're actually have these bioidentical. What does bioidentical mean?
Yeah.
Well, that means that they have structurally made these hormones from plants, like, that are structurally made from plants,
Yeah.
but they're really chemically related to our body's natural hormones and receptors. So what that is now we know that these are much safer. Women are much happier, and men.
Yeah.
Because we now have these replacement of the things that we start losing as we age that keeps us viable and healthy and strong and mentally better, emotionally better, because these bioidentical hormones, when it says bioidentical, so like I said, it's identical to what our body would normally produce.